Can uterine fibroid hinder your pregnancy? The answer is it depends on the size of this fibroid, the location of this fibroid, and the number of this fibroid. Fibroid is simply a benign tumor in the smooth muscle inside your uterus. Okay, we have different types of this fibroid. We have intramural fibroid, we have submucosal fibroid, and we also have subserosal fibroid. Now I'm going to explain them one after the other. Intramural fibroid is found within the muscular wall of the uterus. This type of fibroid can cause pain and heavy bleeding during period. Okay, it can also cause irregular period. Another one is subserosal fibroid. Subserosal fibroid is found on the outer wall of the uterus. We also have submucosal fibroid. Submucosal fibroid is found under the lining of the uterus, okay, and it can bulge into the uterine cavity, and this can affect fertility. Submucosal fibroid can hinder your pregnancy because it bulges inside the cavity of the uterus, okay. When the baby is trying to grow and increase in size, this submucosal fibroid will also increase in size, okay. The baby and the fibroid will be struggling for space. This can affect the growth of the baby, and it can also cause the death of the baby. Now let's talk about the causes of fibroid. Now the first cause of fibroid, even though the cause of fibroid is unknown, okay, but there are other factors. There are factors that have shown, okay, to cause fibroid. The first one is age, okay. Starting period at early age has shown to cause fibroid. The second one is genetics, okay. If fibroid runs in your family, if your first degree relative is suffering from fibroid, it's likely that you can suffer it too. Another one is hormones, estrogen and progesterone, okay. They have shown to promote the growth of fibroid, okay. Another one is diet. Eating food that is low in fiber, too much processed food, okay. Not eating enough vegetables and fruits and protein that can cause fibroid, okay. So this is a reminder for you to start eating healthy. If you are a woman between the age of 30 to 50, start eating healthy. Or if you're a woman in general, don't wait till you get to 30 years. Start eating healthy. Exercise, lack of exercise have shown to cause fibroid too. Live a healthy lifestyle. Another thing that have shown to cause fibroid is obesity. Obesity increases the risk of fibroid. So if you are obese, if you are overweight, try and reduce your size. Now let's talk about symptoms of fibroid, okay. There are some symptoms, signs that you will see, okay. You will suspect that you have fibroid, and when you suspect, okay, you should go straight to the hospital, okay, for a proper diagnosis, okay, and treatment. Now the first symptom is heavy and prolonged period, okay. You're going to have heavy period and prolonged period. If you normally have your period for 2 to 7 days, it might prolong to 10 days or even more than 10 days, okay. Another symptoms of fibroid is pelvic pain or pressure, okay. You're going to have, so much pain. You're going to feel so much pain, okay, on your pelvis, okay. Another symptoms is frequent urination, okay. Now the fibroid has become so big, okay, that it's now resting on your bladder, okay. So you are going to have frequent urination, okay. You're also going to have lower back pain, okay. Another one is inability to pee or empty bladder, okay. Because of the fibroid is resting on your bladder, you will feel like you want to urinate all the time, okay. When you go and urinate, you come back, another one has come, you go again, inability to empty your bladder, okay. Another one is constipation, okay. You're going to have constipation. You're also going to have pain during sex, okay, pain during sex. And that one is enlarged abdomen, okay. As the fibroid is growing, your abdomen will be enlarged, like it will look as if you're pregnant but you're not pregnant, okay. And that one is fullness or bloating. You're going to feel bloated all the time, okay. You're going to feel very full. You know how pregnant women feels. You're going to feel very full and bloated, okay. Another one is infertility or miscarriage. If you have submucosal fibroid, meaning is growing under the lining of your uterus, submucosal fibroid bulges inside the cavity of the uterus, okay. As the baby is growing, the fibroid is growing and it's going to struggle for space with the baby, okay. It can cause miscarriage, okay. It can also cause infertility by blocking the fallopian tube. Now let's talk about diagnosis of this fibroid. Fibroid can be diagnosed, okay, through pelvic scan or ultrasound, okay. When these two scans are done, it can dictate if you have fibroid or not. If you have gained something from this video, kindly give this video a thumbs up, share this video, like, and don't forget to on your notification button, okay, so that whenever I put out videos like this, you'll be the first to know. See you on my next video.